You're an FI1 on a general medical on-call shift. You're called to attend a cardiac arrest, and the person leading the arrest asks you to prepare and administer adrenaline, a drug used in cardiac arrests. You find that you are unfamiliar with the equipment and that you are unable to do this. Another of your colleagues takes over and administers the drug correctly. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Ask a colleague to demonstrate how to prepare the drug in a non-emergency setting. B. Fill in an incident form about the situation. C. Contact your foundation program director to arrange appropriate training for this skill. D. Make sure that you're doing airway management at the next cardiac arrest you attend, where you feel more confident. E. Revise the basic life support BLS guidelines. Answer: ACEDB. Once you have identified a gap in your knowledge or skill set, you should work to set this right. In this scenario, it is important to be proficient at this skill for future emergency situations. Therefore, you should be proactive in organizing necessary training. The most appropriate action would therefore be asking a colleague to demonstrate the skill. Contacting your foundation program director to arrange teaching on this skill, C, could result in training, but there could be a delay in arranging this teaching, and administering adrenaline during an arrest is a simple skill that should not require structured training. Revising the BLS guidelines, E, may be useful for your general emergency knowledge, but it would be better to seek out practical teaching for this situation. Avoiding administering the drug in future cardiac arrests, D, is not a professional way of dealing with a lack of knowledge, as it is important to learn and improve for the future. Filling in an incident form, B, would be unnecessary and irrelevant as the patient has not come to harm. You are taking blood from a patient who is due to go to theater later this afternoon. While conversing with her, you discover that she is quite confused, and when asking her about the operation, she becomes distressed and tells you that she refuses to undergo the surgery and that she just wants to be left alone. Choose the 3 most appropriate actions to take in this situation. A. Ask the nursing staff for more information regarding the patient's confused state. B. Ask your registrar to reconsent the patient for theater using the principles of best interest, as she now lacks the capacity to make the decision herself. C. Discuss the patient's confusion and capacity with your registrar. D. Get an emergency psychiatric review of the patient. E. Ignore the patient's new onset confusion. F. Inform the operating theater that the surgery should be canceled. G. Perform a mini-mental state examination and investigate the patient's new confusion. H. Return to the patient in a couple of hours to see if the confusion has resolved. Answer: ACG. Patient capacity can change, and that can have an impact on the consent they have already given for procedures. In this scenario, a capacity assessment would need to be made to assess if the surgery should continue without the patient's consent. To get more information about her confusion, asking nursing staff is a good start, as they spend a lot more time directly with patients. New onset confusion can be a symptom of acute illness, so you should begin to investigate the cause appropriately, making option G an appropriate course of action. The final appropriate response here is option C. Your registrar should be made aware of this patient's confusion and refusal to go to theater, as this could affect the day's list, and it would be wrong to send her to theater without a full capacity assessment. The inappropriate responses in this scenario include getting unnecessary reviews of the patient by psychiatry without first investigating the cause yourself. D. Ignoring the situation. Sending a patient to theater when she refuses consent can amount to assault. Canceling the surgery before investigating the cause of the patient's confusion and her reasons for refusal. F. Which is premature. And waiting to see if the patient improves. H. This final response involves delaying a decision. And even if the patient does improve, your senior should still be made aware of their deterioration, as it may be more appropriate to delay the surgery until a cause for the confusion has been found.